Good afternoon. The question I want to answer for you today is what is the difference between Suboxone, Bunavail, and Zubsolv? Again, what is the difference between Suboxone, Bunavail, and Zubsolv? My name is Dr. B, and this channel is Dr. B, Addiction and Recovery. I'm going to really make this simple for you and short for you to clear out any confusion that you may have about these drugs. Essentially, I would think of it in this way. The three drugs, Suboxone, Bunavail, and Zubsolv, are exactly the same fundamental chemical structure, buprenorphine, and the difference between these three companies, these three formulations, is the delivery system, okay? So, let's assume that this pen is a missile, okay? And inside of it is ink. And there's multiple different types of pens with the exact same kind of ink under the delivery system. And that is the difference between these three drugs, Suboxone, Zubsolv, and Bunavil. What they market between the difference of these delivery systems is the following. They may market how long it takes to dissolve. They may market how it tastes. They may market the tolerability of putting that medication under your tongue, on your cheek, etc. And, a few other things that are the dressing of the delivery system of the buprenorphine. One other thing that is different between these medications that they market is the following. And I don't want to say which does which because I think, the data is not so clear on that. I don't want to promote any drug versus other. I want you to conceptually understand the difference between these three things. One, the difference between Suboxone, Zubsolv, and Bunavil is the missile delivery system, and the missile inside of it, the power punching chemical structure is the same thing. What they market is how quickly it gets into your system, how long it has to stay under your tongue, how it tastes. One other thing that they really market in the difference is the following. One brand, for example, Zubsolv, might say, hey, our delivery system through your buccal mucosa, through your cheek, is so well done and so well structured that you actually need less of the active ingredient, which is buprenorphine, than the other brand. That's for you to decide whether you're getting the same amount of medication or whether it matters. I'm just concerned about the clinical effect. So one brand might say, you know what? My delivery system is so strong that we need less of the nuclear bomb in there. And somehow that's supposed to be appealing to the consumer. One other thing with these three medications that's really important to understand is that the active ingredients in all three of them are buprenorphine, which is, the really main thing that we want to get into your system. And naloxone, which is the blocker. And in all three of these, I'm going to make a little side issue here in the discussion about the naloxone, which I have in other views. It's really important to understand something. Whether the naloxone is in that medication or it is not in that medication makes no difference. And I'm going to continue to use the missile delivery system to make that point. Let's say I have a delivery, I put a missile, a bomb in the delivery system, and then there's a secondary bomb B. When that system explodes, that secondary bomb B does not explode when used properly. So when you put any of these medications in your mouth, used as directed by the clinician and by the manufacturer, the only thing that gets turned on in your body is the buprenorphine. The naloxone is an inactive ingredient and it simply dissolves, goes in your bloodstream, it doesn't get turned on, doesn't hit any opiate receptors, and you pee it out. So essentially, there is no other ingredient in these formulations except the buprenorphine. And that begs the question, and you might ask, well, why is it in there? And here's why it's in there. Because initially, when you had things just like Subutex or buprenorphine, and it was in a pill form, what was happening was that people were taking the pill, they were grinding it up, and they were shooting it up to get some sort of an effect, an immediate rush of some sort. And so the manufacturer that puts out Suboxone came out with the formulation of a strip. And in that strip, there's buprenorphine and naloxone. Now, if you take the strip in your mouth, the only thing that's active is the buprenorphine. If you chopped up the strip somehow and decided to do some crazy thing like dissolve it and shoot it up in your vein, the naloxone gets turned on at that time. And naloxone is much more competitive than buprenorphine for your opiate receptors. So that means if you release buprenorphine and you release naloxone at the same time in your venous system, the naloxone beats the buprenorphine to the opiate receptor, blocks it, and does not allow the buprenorphine to hit the opiate receptor. So as I read through the internet and I talk to patients all the time, there seems to be an incredible amount of confusion and just misunderstanding of this blocker that's in the, whether it's the Suboxone, Bunavail, or Zubsolv. That blocker is basically a dead ingredient that only gets turned on, only gets activated if you use the drug intravenously. And so as I hear a lot of patients having, oh, the blocker does this for me, the blocker does that for me. The blocker, you might as well assume it doesn't exist. It's that simple. The three medications, Suboxone, Bunavail, Zubsolv, are exactly the same active ingredient. What they boast is that you might need a little bit of less ingredient in one versus the other because the delivery system is done so well that it opens things up and you need less. Or it takes less time to dissolve. Or it tastes better. Or even things like it's easier to carry, put in your pocket, put in a pill box, and so on. That's the only difference between these three medications. Which one would I advocate for or tell patients one is better than the other? None of them. And here's the bottom line for me. It's patient preference. So let's say, for example, everyone talks about Suboxone being very bad tasting. I have patients that are on Suboxone and this is the medication they've taken for quite some time. If I went up to them and said, hey, Bunavil tastes like lime, it tastes really well, it dissolves a lot faster, and you need a lot less buprenorphine. And even if I got them to try it, it wouldn't even work for a day. And that's because the ritual of taking the Suboxone is what they've become used to. And it's okay if you replace the ritual of shooting up heroin and putting something on your tongue. I'm okay with that, even though some might argue, well, that's an addiction. That's a whole different story. We could talk about that in other videos. So as far as patient preference is the only thing that dictates my idea of which medication to prescribe. I myself personally usually start off with Suboxone, and it evolves from there depending on the patient's route to recovery and use. Other than that, the only other time I choose a different medication of the repertoire of these buprenorphine products is if there's any concern that there's diversion, they're selling the medication, or somehow that formulation they abuse. For example, I actually did have a patient and still do have a patient who has this propensity for smoking his Suboxone strips. It's just something that he keeps doing, and he admits it, and we discuss it often, and it's, we've almost got it down to where he doesn't do it, but he likes to put his Suboxone strips in rolling paper with the rest of his tobacco and smoke it. So in cases like that, I might say, hey, we're not doing that anymore. We're going to change to one of the other formulations, and I did not discuss Subutex. Please leave any questions or comments that you have below in the questions and comment section. If you click over here, you can refer to other videos about Suboxone type of products. Also, please subscribe to the channel and ring the bell. We really appreciate that. Have a wonderful day and can't wait till next week.